Thank you so much. Good morning, everyone. 5 minutes to wellness. Today we're going to be talking about resistance training. So raise your hand if you've heard of the concept of resistance training. Excellent. Everybody in the room. We've got two broad categories that I've outlined. We've got body weight resistance training and body weight plus. We keep it pretty easy there. So if we think of body weight resistance training, you might be thinking, well, isn't that every day, all day? I'm moving my body around. That's my resistance. Body weight resistance training involves using your body in very specific controlled movements that strengthen you such that your activity of daily living can be done quite easily and you have resiliency in those activities. So when we talk about resistance training, the main thing that we're looking to capitalize on is the fact that your body conforms to stresses placed on it. We've got multiple examples of this. There is the concept of bone density, and the concept of resistance training towards strengthening your bone and reducing density loss is now gaining tremendous support in all areas of medicine. So this basic concept capitalizes again on conformation to stresses by loading your bone during work. And this is simple workouts. These could be some of the things I'll be covering in just a moment, but this could be step-up exercises. These could be squats with additional weight eventually, but at the very beginning, these exercises can be done just with your body weight alone. So we'll dive in a little deeper on that in just a moment. But the concept there is by loading bone, in this case, it causes something called a piezoelectric effect. That's actually an electrical charge that's being displaced in the bone by the pressure that's placed on it, and that draws more minerals in, causes your bone to be mineralized and strengthened as a result. Okay? The same thing happens in muscle. There's a term called sarcopenia. Who wants sarcopenia? Sounds horrible. Actually sounds a lot worse than it is, but it's bad in and of itself. Sarcomere is the contractile unit of a muscle cell, and penia means low, like low density. So in this case, you can control against sarcopenia, which is induced by age-related lack of activity or sedentary lifestyle. So we can guard against bone density loss and loss of muscle mass through resistance exercise. Again, your body conforms to stresses placed on it. So, here are the rules. Keep it functional. You hear me use this term so often, but what we're getting at there is that we match our movements to activity of daily living and or hobbies. So, I'm going to give you one example of an exercise I hear my patients often do prior to me correcting them, and this is overhead work, reaching overhead and pulling down weight. Now, unless you are a skydiving instructor, and you're having to control for the descent with the parachute, you don't really, in your activities of daily living, need to reach up and pull weight down like this. That's extremely high stress on the shoulder, especially when it's loaded under weight. And this is the cause. Now, you know I'm up here for your benefit because this is the cause of a lot of the visits to my office initially, okay? So, reaching up overhead and pulling down weight, while it might do good work for strengthening certain muscles, we have to look at that, and the litmus test is, do I need to match this movement to activities of daily living, okay? And unless you're a skydiving instructor or some other small caveat, that's probably not the best thing. So keep it functional. The concept here is that if we can strengthen movements that we do on a regular basis, but we can strengthen them above and beyond and create capacity in our body to do those with ease, this will pay off in the long run. So let me give you some more benefits. We've talked about lack of bone density loss or prevention of bone density degradation. We've talked about muscle strengthening, but let's talk about balance and coordination. As we age, one of the chief risks to our health is falls. And this might sound strange, but I just celebrated my 40th birthday, and I almost had a substantial fall. I was carrying my daughter in, she was sleeping, and I thought, got this set. We brought her from Grandma and Grandpa's house. I'm going to carry her straight in out of the car, load her in her room, and just let her sleep through the night. So I'm walking in the dark with my sweet little angel, 60 pounds now, like this, and the dance bag is laid out in front of me. I'm unaware of this. So here I go, and the next thing I know, I'm doing this. Well, fortunately, about 6 months before this event, which happened a few months ago, I started working with a personal trainer, because it's one thing to know this stuff, and it's another thing to practice it, right? And when I went in to meet my friend Eric, who's a personal trainer, I said, I need help in core stability, and I need some upper body help, but my legs are super strong. And he did an evaluation. He said, well, you were right about 2 of the 3 things. You need help in core stability and your upper body strength. I said, what about these legs? He goes, they're a mess. After about 3 months of training with him, though, I was doing single leg exercises. Very simple things, but stepping up about 20% higher than I normally would, climbing stairs, and for many more repetitions than I would normally do. How is this going to pay off for me, I would think, when he had me do this? Well, fast forward to me walking across the room with Angel and kicking the dance bag. I did one of these like 3 times. I didn't drop her. I set her down, and I thought, thank you, Eric. I wish somebody could have seen that. Here's some of the basic rules. 2 to 3 times per week, okay? So this is simple to start. 2 to 3 sets. Now, these are just generalized rules. If we're talking about planks, okay, that's a static exercise where you're holding yourself in a position. Then your goal is to increase time or duration. Start with 20 seconds, build to 30, then a minute is a great goal. With all of these things, clear the exercise first with your doctor, physical therapist, chiropractor, and I do encourage getting help with this. Even with all the knowledge I have of the human body, I went to a personal trainer because he was able to objectively evaluate me and help me figure out the workout that was best for me, okay? Keep it healthy and have a great month until we see you next month.